There is a parasite spreading across the United States right now. Not a virus, not bacteria. A microscopic parasite called Cyclospora. And as of this week, nearly 7,000 people across 34 states have confirmed or probable cases. That is more than double the total for all of last year. Health officials have not yet identified a single source. Cases are still rising. The reason this matters is not just the number. It is the fact that Cyclospora behaves differently from every other foodborne illness most people are familiar with. It does not behave like food poisoning. It does not behave like a stomach bug. And if you do not know what you are looking for, you will wait far too long before connecting your symptoms to a parasite, and far too long before getting the one antibiotic that treats it. Here are the 8 signs. Sign 1. Watery diarrhea that is explosive and comes in waves. This is the symptom that defines Cyclospora infection and the one that has driven every headline about this outbreak. The diarrhea is watery, sudden, and forceful. The term explosive is used clinically, not for emphasis. It tends to come in bursts several times a day, interspersed with periods of feeling relatively normal before returning. This on and off pattern is diagnostically important. Most bacterial food poisoning produces more sustained, continuous symptoms. Cyclospora produces waves, which is why people frequently assume they are improving, resume normal activity, and then are hit again. The relapsing nature of the diarrhea is one of the most characteristic features of this infection. Sign 2. Symptoms that start 1 to 2 weeks after exposure. If you ate contaminated food yesterday and feel sick today, this is probably not Cyclospora. The incubation period for cyclosporiasis is 7 to 10 days. That delay is longer than almost any other common foodborne illness and is the primary reason people fail to connect their symptoms to what they ate. By the time the diarrhea begins, the meal that caused it is a distant memory. The salad from 10 days ago. The restaurant visit that felt uneventful. The produce at the family gathering last week. The link between exposure and symptom is exactly long enough to be invisible without knowing to look for it. If your symptoms began 7 to 14 days after eating fresh produce, particularly salad greens, cilantro, basil, raspberries, snow peas, or green onions, Cyclospora must be on the list. Sign 3. Cramping and bloating that precedes or accompanies the diarrhea. Before the diarrhea begins, and persisting throughout the infection, most people with cyclosporiasis experience significant abdominal cramping and bloating. The cramping is not mild. It is described as severe enough to double people over, sudden, intense, and located diffusely across the lower abdomen rather than in one specific spot. The bloating produces visible abdominal distension and significant discomfort. Gas is often excessive. The gut is inflamed and dysfunctional. The intestinal lining is being disrupted by the parasite's life cycle inside the epithelial cells of the small intestine, and the cramping is the muscular response to that disruption. Sign 4. Nausea with or without vomiting. Cyclospora infection frequently causes nausea, sometimes severe, that may or may not progress to vomiting. The nausea is often worst in the morning and before bowel movements. In some patients, it is the dominant symptom, leading to the assumption that this is a stomach bug or food poisoning rather than a parasitic infection. Vomiting, when it occurs, tends to be less severe and less frequent than in norovirus infection, which is another feature that makes cyclosporiasis look different from typical gastroenteritis to people who have experienced both. The gut feels sick. The output is primarily from the lower intestinal tract. The nausea is real and debilitating, but vomiting is often absent or occurs only once or twice. Sign 5. Loss of appetite that lingers for weeks. Most foodborne illnesses resolve the appetite disruption within a few days of the acute phase passing. Cyclospora does not. Loss of appetite in cyclosporiasis is prolonged, lasting weeks in many cases, and is one of the symptoms most responsible for the significant weight loss that untreated infection produces. The appetite loss is not purely psychological. The parasite invades the epithelial cells of the small intestine, the cells responsible for absorbing nutrients. When those cells are compromised, nutrient absorption fails. The body is not receiving adequate nutrition even when food is consumed. The appetite suppression may be, in part, the body reducing demand when supply has been cut off. Patients who describe losing 5 to 10 pounds during a gastrointestinal illness lasting more than 2 weeks without a clear diagnosis should have Cyclospora specifically tested for. Sign 6. Profound fatigue that outlasts the diarrhea. This is the sign that most surprises people who have not encountered Cyclospora before. The fatigue is not proportional to the diarrhea. It is not the ordinary tiredness of being unwell for a few days. It is a heavy, persistent exhaustion that continues, and in some cases worsens, even as the acute gastrointestinal symptoms begin to improve. The mechanism is the combination of dehydration from fluid loss, electrolyte depletion, nutritional malabsorption from damaged intestinal lining, and the systemic inflammatory response to a prolonged parasitic infection. The body is fighting an infection in the gut while simultaneously being deprived of the nutrients it needs to fight it. People with untreated cyclosporiasis frequently report being unable to work or function normally for weeks, not because the diarrhea is constant, but because the fatigue that accompanies it is. An illness that started as gastrointestinal and is now primarily characterized by profound exhaustion with intermittent digestive symptoms is a recognized late-phase presentation of cyclosporiasis. Sign 7. Symptoms that last weeks, not days. This is the most clinically significant distinguishing feature of Cyclospora infection compared to most other causes of gastroenteritis. Untreated cyclosporiasis lasts weeks to months. The average duration of untreated illness is 6 to 7 weeks. Norovirus resolves in 1 to 3 days. Bacterial food poisoning typically resolves in 3 to 7 days. A gastrointestinal illness in its 4th week is not a lingering stomach bug. It is a parasite. The prolonged course is driven by the parasite's life cycle. Cyclospora completes its entire reproductive cycle inside the cells of the human intestinal tract. It does not require another host. It does not pass through an intermediate stage, and the immune system alone is often insufficient to clear it without antibiotic intervention. The illness will cycle and relapse until treated or, in healthy individuals with strong immune function, until the infection self-resolves after many weeks. If you have been sick for more than 2 weeks with intermittent diarrhea, cramping, nausea, fatigue, and reduced appetite, the duration alone is a sign. Sign 8. Symptoms after eating fresh produce, especially in the last 30 days. This is the exposure sign, and right now, it is the most important one. The current outbreak has been linked to fresh leafy greens, with iceberg lettuce from central Mexico identified as a likely source. Taylor Fresh Foods has already issued a recall of iceberg lettuce products. Michigan health officials have pointed to lettuce and salad greens as the probable vehicle in the Midwest cluster. Previous Cyclospora outbreaks have been linked to bagged salad mixes, fresh cilantro, fresh basil, raspberries, snow peas, and green onions. Consistently produce consumed raw. Cyclospora is not killed by refrigeration. It is not visible on produce. It cannot be detected by taste or smell. Washing produce reduces risk but does not eliminate it. The parasite can adhere to leaf surfaces and survive standard rinsing. Cooking kills it, but the foods most commonly implicated in outbreaks are foods that are eaten raw. If you have eaten any fresh leafy greens, salad kits, or the produce items listed above in the past 30 days and developed any of the symptoms in this video 7 to 14 days later, you need to be tested. What to do? The standard stool test for ova and parasites does not reliably detect Cyclospora. You must specifically ask for Cyclospora testing by name. The CDC has issued a health alert to clinicians instructing them to request it specifically, because routine stool tests will miss it. PCR-based molecular testing is the most sensitive method and is available at most hospital laboratories. The treatment is a specific antibiotic, trimethoprim sulfamethoxazole, known as Bactrim or Septra. Without it, the illness continues. With it, symptoms typically begin resolving within a few days. There is no over-the-counter treatment. Antidiarrheal medications manage the symptom but do not address the parasite. Cyclospora does not spread person to person. You cannot catch it from an infected person in your household. You can only get it from contaminated food or water, which means the risk in your home is the produce currently in your kitchen, not the people around you. If you are immunocompromised, elderly, or have young children with these symptoms, do not wait. Dehydration from prolonged diarrhea moves faster in vulnerable populations, and untreated parasitic infection in immunocompromised individuals can become severe. Seek care promptly and name the parasite specifically when you do. Nearly 7,000 cases, 34 states, a source not yet fully identified, an incubation period long enough to make the connection invisible, a standard stool test that will miss it unless you ask for the right one, and an illness that lasts weeks if untreated and clears within days once the right antibiotic is given. The information gap is the problem, not the parasite. Now you know what to ask for.